Do you have back pain? If you do, I bet getting in and out of the bed is pretty painful. In this video, I'm going to show you the log roll technique that I show all my spinal patients and even my abdominal surgery patients how to get in and out of the bed with the least amount of pain possible. I'm Dr. Sean, your PT guy, and our videos help you learn how to move better and stay independent so you can enjoy your life. Let's get started. Disclaimer! So let's go over that log roll technique now. The first thing you need to realize is depending on your height, that's where you're going to sit when you're getting into the bed. So this is about right for me, but whenever you sit down, just make sure that your thighs are completely fully supported, because you don't want to be too close to the edge, because then when you go down, you could feel like you're going to roll off. All right. So I'm fully supported. My bottom's back as far as it can go in the bed for right now. And we're going to bring ourselves down on our shoulder. I'm going to get into a little bit of physics here, so stay with me. This is important. So here's the bed, all right? And here's me. This is my head, this is my legs. So if I come down on my shoulder, my knees and my legs naturally will come up because of the leverage. But if I come down on my elbow first like this, then what happens is now I'm going to try to do this, and you can see a bend in the back like that. That's going to pinch down on your back. That's not going to be very helpful for when you have back pain. We're trying to minimize the twisting and the bending that's happening at the spine. So if I'm sitting on the bed and I come down on my shoulder, my legs naturally come up with leverage. So let me show you how that looks. So I'm not going to put my arm down like this, because if I do this, then I try to bring my legs up, you can see I'm pinching my back. That's not going to be very helpful. I want to come down on my shoulder. So I'm going to take this hand and brace myself so I'm not going to feel like I'm going to crash. So I'm going to bring my hand over like this, and then I'm going to lay down on my shoulder, and notice my legs naturally come up, and they're right there. Now here's where oftentimes a lot of people get this wrong. So they did that part perfect, looks great. They came on their shoulder, everything looks good, and now they turn to roll over like this, and now they're crooked. So then they have to try to, they're trying to shimmy their way over to the middle of the bed, so they're not feeling like they're going to roll off. That's going to be painful. So what do you need to do? When you are on the side and you just came down, just walk your legs back a little bit first to plant them more in the center of the bed, and then you're going to bring your knees and your shoulder over at the same time like this. And now I'm level. Perfect. That's great. Now, how do you get up? You slide up your foot. You slide up the other foot. By the way, don't do this. Don't lift up, because that's going to put some pressure on your back when you do that. But if you slide it up and the bed does the work to hold up your leg, that's going to feel much better. And you slide this one up, and then you're going to bring your knees and your shoulders and your arms over at the same exact time so that you're not twisting that spine. So the knees drop over. I'm reaching across like this. Very protecting of the spine and the abdomen. If you had abdominal surgery, same thing. So it protects this whole area. And then you tuck your feet up a little bit closer to the edge like a little ball. And then you're going to drop your legs off while at the same time pressing here to come sit up. Let me show you what I mean. So my legs are right on the edge. They're not back here. They're really close to the edge, ready to go. I'm not going to drop them off first, because then I would be bending my back. I don't want to do that. So I'm going to do this. I'm going to whoosh, boom. And that's how you do it. So that's the log roll technique. When you're rolling, just be careful. Don't roll too fast and roll off the bed. We're not about having falls. That's why I created a Don't Fall Prevention Guide. And you can get that down in the link below if you want it. But if you want more videos like this to learn how to move better and stay independent so you can enjoy your life, click the subscribe button down below, and we'll see you in the next video.